Another outbreak of the deadly disease is upon us. So all hands must be on deck to prevent an all-out epidemic. Nigeria now has a total of 172 monkeypox infections and 4 deaths after 15 new confirmed cases. Reports by the Nigerian Center for Disease Control, NCDC, shows that more than 50% of the cases were recorded among men. According to reports, out of the 172 cases reported from the 1st of January to the 7th of August, men accounted for 115 infections. So we have it, monkeypox.
Yeah, it is. We have to go through this cycle every other decade.
Just coming out from COVID.
Yeah, we are just
not fully out of the woods.
I think we just need to just take it as the new normal. That we have to be very particular about our health, about our hygiene, things that we can do, things that we can move near. All these things, like I said, in some countries, they've not lifted the face mask rule. Not because they're afraid of anything, because they assume that it's better to be safe than sorry. And that's what we need to do. Nigerians have the tendency, we are very religious people. If you should say this in some instances, people will be snapping their fingers. That is not their portion. But it's not anybody's portion once you are very careful and then do the needful. That's what we need to tell our listeners. These are symptoms that you need to see. Once you have them, please report yourself to the nearest centers. So because monkeypox, if caught on time, is still treatable. On time. Not when it's at an advanced stage that people can do. And I understand that the vaccines are now available, to which that, of course, people need to get it. Let our listeners know that this is real and it's not anybody's portion.
What do I have to expose myself to land myself the monkeypox?
Well, I think, contained in the report, they said most of those people afflicted now are men. I think we just have to look at our ways of life, look at our ways, the kind of company we keep, the kind of attitude towards life, because it's also about personal attitude towards life. I won't say more than that. So if men are found to be more susceptible to this disease, they should caution themselves and they should know the company they keep at any point in time. They should change their lifestyle and ways of life. The WHO came out with a report before during the COVID that they were expecting about 500,000 or 1 million to have died in Africa. And they must have been surprised. Surprised because our template here and temperature here is actually against the multiplication of the COVID. So, but we should not take that one for granted. It is also a warning to government that we should not allow the spread of an epidemic to be the only solution to the time that we're going to prepare for emergencies. We love emergencies in Nigeria. And I think both the government and the people should also make sure that they watch out for the symptoms and try as much as possible to reduce it. I can't see any government now treating anybody for COVID. When you have COVID now, you're on your own. OYO. So people should take extra measures, look out for these symptoms, and make sure that they avoid it as soon as possible, and make a report before the thing trigger off.
GKB, the good thing about it is that we have the vaccine.
That's what I said.
So we have the vaccine.
But again, having it is different from having access to it. But that's also a very fundamental challenge that we face as a nation. People know that it's there, but whether they will go and get it is another thing. Or they will now start to commercialize it. Because remember at a point in time when certain hospitals were given the right to administer the COVID something, they start turning to a money-making venture. That people have to be forced back to primary health cares. Because I remember that somewhere around Abulegba, there are some hospitals that were licensed for COVID, and they turned it to a money-making.
Yes.
So people are now rushed back to the primary health care centers to get their COVID shots. I hope that will not happen in the case of monkeypox. Because like I said, this one is more feasible. It's not something you can really hide. And then, so you don't become ostracized by people simply because they see the signs on you. Better to go there on time and tell the people what you are going through. That is the key to prevent this thing from becoming an epidemic.
Okay, I have Ade calling from London. Thank you for joining us, Ade.
I'm greeting to my two brothers in the studio. And I think Babalola is not around. Please, I want to quickly comment on that. The Deputy Senate President, former one.
Please.
I think what Nigerians what to do is that they can write a character reference, let the federal government, and give it to the judge. They could take that into consideration and they could just find him. Because if they convict him and he has a criminal record, he won't be able to come to London anymore. And he has a property here. That's my fear. I don't want to convict you to have criminal record. If federal government can write a character reference to the judge, not that the thing should not go as normal, but they take that to consideration and be lenient with him and find him instead of convicting him. Because if he has a criminal record, that's it for him. So I pray it will not be like that. You know, we are all Nigerians, we should be able to help each other. Regarding the monkeypox, hygiene is the key, hygiene. And Nigeria should develop the vaccine and should be awareness to our people now. Because it's happening in my state and on those things. There should be awareness so people can be careful. God will save our country and will save Nigeria. Save us.
Thank you, Ade. Thank you, Ade. It's saying that for Ikweremadu, that
But
what
again,
can be done when we
the
get to
letter
that
to
stage.
verse
But
was
still-
character.
It's like a character sketch.
But that will still be when they commence
To
with
get
the
to
trial.
the trial.
Trial proper. Okay.
Nothing can be
Not
done
just
before then.
All right.